Well, ladies, it should come as no surprise that National Donor Day falls on February 14th, Valentine's Day, a day that's all about love. Because according to Dr. Tim Laird, the chief medical officer at Health First, organ donation is one of the most powerful ways you can show love to someone else by giving them life. But he says only a portion of Americans actually do that.
I think 90% or so of Americans believe in and want to donate, but only about 60% actually fill out the card or do the online kind of registration.
Why do you think that is? Why isn't that number higher?
Yeah, I think it's the inertia. And I think it's it could also be maybe a distrust of the donation process or doctors or the decisions like that, and wondering whether it might affect them in an adverse way, but it doesn't, and it's only done at the end of life if you're otherwise going to pass away, so I think better understanding and better communication, like what you're doing, for Organ Donor Day, will help dispel some of the myths.
Now, I asked Dr. Laird about some of the most common myths that he hears from people who are hesitant about signing up to be an organ donor, including one of the most popular, that first responders and healthcare providers won't try as hard to save your life if they know you're signed up to be an organ donor.
I think that is something that maybe people consider, but doesn't happen in reality. I mean, in reality, this isn't even considered until all measures have been exhausted, and so the person has passed away or is brain dead, and that's when organ donation is even considered by the medical team.
In fact, according to organdonor.gov, only 3 in every 1,000 people die in a way that actually allows for organ donation, which is another reason everyone is encouraged to sign up. And by everyone, Dr. Laird does mean almost everyone. He says it's important to have a diverse list of donors and that there are very few factors that could disqualify someone from being a potential donor.
Yeah, very few people can't. If you're over the age of 18, and you sign up, even if you're older, have other medical conditions, you should go ahead and sign up. At the time of donation, doctors will determine whether any of the organs are able to be transplanted. And so really, no matter your age, health status, ethnicity, none of that should play a part. You very well could help save somebody's life. There are certain minority groups that have a little bit more of the disease, the chronic diseases that result in needing new organs. And so you're right. No matter your ethnicity, you should sign up, because there are unfortunately there's I think it's 17 people a day who die waiting for an organ transplant, and and minorities are part of that. And so absolutely, because of the immune system and the blood type checks and all the different checks to make sure that there is a suitable organ, it's important that we have a wide, diverse array of donors.
Dr. Laird says it's never easy to talk about the end of life, but if you do choose to be an organ donor, you should have that conversation with your loved ones now. That way, your wishes are clear and everyone feels comfortable carrying them out when the time comes. Maybe you want to sign up as a family like he and his did. It's easy to do either at the DMV or online, and we have details about how to register and what you should know before you do over at clickorlando.com/news6 at 9.